$74.3 million in the red. It's the Guam Memorial Hospital's expected shortfall for fiscal year 2025, according to GMH Chief Financial Officer Yuka Hechanova.
Our expected funding sources in FY 2025 will not be sufficient to cover the projected operating expenses.
Funding sources from patient revenues, Department of Corrections, and federal grants are expected to amount to $157 million, but their projected operating expenses is $232 million. It's why they're asking the legislature for $50 million from the general fund and $23 million from the pharmaceutical fund.
The most notable increases are expected in personnel costs, contractual, and supplies. Personnel costs for FY 2025 are expected to be $14 million higher than FY 2024.
The budget request also reveals FY 24 billing amounted to $212 million, but the actual collections were $76 million. That's just 36% of medical bills paid.
If your patient population is the type that just cannot pay, there's no way you can keep operating without some kind of a subsidy.
Okay.
And that's exactly the situation that we're in here.
Acting Hospital Administrator Dr. Dustin Prince offering senators three options. The first is to maintain a fixed annual subsidy from the general fund of $60 to $80 million a year. If the legislature can only give them $30 million, then the second option is to cut most of the secondary tenants or outpatient services. And if the subsidy is less than $10 million, the third option is to close all secondary tenants.
To be basically a maternal child health pediatrics ER. The question I ask is this what the people of Guam want?
The threat of cutting much-needed services not sitting well with several senators, to include Senator Telo Taitagui.
You're throwing us options. You're not throwing us, this is what we plan to do. You're throwing it on our table now to say, okay, well, here are the options that you have. And, you haven't said we can work with any of these three options that you put in front of us. That's not our job. Our job is to listen to what you are going to do to fix the hospital, to provide the services that is needed at this hospital, and how much it's going to cost you.
And Speaker Therese Terlahi with a reminder, it's taxpayer dollars they're asking for.
What you want from the taxpayers of Guam is $74 million. That would come in the form of pharmaceutical fund and general fund. And the pharmaceutical fund comes from the business privilege taxes. So it's all taxpayer money, $74 million.